Hello and welcome everyone to today's session. Innovative AI delivers unified cost containment approach. During our time today, our speakers will share with you firsthand experience around the growing need for more holistic fraud detection and the use of artificial intelligence to improve fraud, waste, abuse, and payment integrity programs. Our first speaker with us today is Kurt Speer. Kurt is the Vice President of Financial Investigations and Provider Review for Highmark. In this role, he leads Highmark's healthcare anti-fraud program and is responsible for preventing, detecting, and investigating instances of provider member fraud, waste, and abuse in the payment for healthcare services. Prior to joining Highmark, Mr. Speer was a senior manager at Deloitte. He has well over 20 years of experience in leading organizations in the identification and mitigation of various enterprise risks, including fraud, technology, and cybersecurity threats and compliance issues. Kurt has worked across a diverse set of industries and clients, including insurance companies. Mr. Speer received his bachelor's degree from Marietta College in Marietta, Ohio, and is a certified fraud examiner and certified information security professional. Our next speaker is Rena Belinsky. Rena is the Vice President of Customer Success at Codaxo. Prior to Codaxo, she spent 15 years at CO Health Analytics, an EXL company, where she was the Chief Pharmacy Officer with responsibility for building several clinical cost containment programs. She also developed the Retail Pharmacy Fraud, Waste, and Abuse program, which included pharmacy fraud investigations and compliance audits. She also served as a vice president of strategic accounts at EXL, managing multiple payer and PBM clients. Prior to CO, she spent many years as the chief operating officer for a regional home infusion, home health, and DME company. She has a Doctor of Pharmacy degree from the University of Illinois College of Pharmacy in Chicago, and she is also an accredited healthcare fraud investigator. At this time, I will turn it over to Kurt.
Hi, good morning, everyone, and thanks for joining us today. So Highmark is one of the leading health insurance organization and is an independent licensee of Blue Cross Blue Shield. We're the fourth largest Blue Cross and Blue Shield affiliated organization. We are a blended health organization, meaning that we have both the payer and provider side. We have approximately 6 million covered lives across Pennsylvania, Delaware, West Virginia, and New York. And we also have 13 hospitals as part of our healthcare system, as well as a reinsurance group, Highmark Insurance Group, United Concordia Dental, and a number of other organizations under the Highmark Health umbrella.
Hi, everyone. Good morning. Codaxo is a company that was founded in 2017, and it was born from academia. So our founder was at the Georgia Institute of Technology, where he was looking to solve for the fraud, waste, and abuse healthcare problem that exists in the United States today. And the technology helps plans and agencies and payers to detect schemes faster than what's on the market today. And the platform encompasses not just fraud, waste, and abuse, but other types of services such as payment integrity, network and contract management, prior auth, and provider coding and billing. So it's really a full payment integrity suite in one platform, giving visibility for all users to be in one platform. So the healthcare fraud trends in the United States, these are numbers from NHCAA, which is the National Healthcare Anti-Fraud Association. Very concerning. These are not new, but they are pretty staggering and are increasing and on the rise. Just this year, you can see there were quite a few individuals charged with healthcare fraud, and these numbers continue to grow. If you think of this in the terms of healthcare as a percentage of our GDP, these numbers are very, very voluminous, and we are looking to solve for this issue.
So one thing we wanted to walk through today and really focus on is the evolution of cost containment and how the market is really demanding us to go beyond simply fraud to more of a holistic approach. And what I mean by that is historically, we have always looked for sort of the red flags within data. So we've looked at pattern recognition and data analytics, which has required us to really have a large volume of claims data and wait for those claims to be paid so that we really have a large set of claims that we can go back and run analytics on to look for those red flags and actually have a pattern. And the underlying drivers for that was, fraud within healthcare, right? So we've all had fraud programs at our health plans for a number of years. And I would say over the past probably 5 to 6 years, the market has really demanded us to all go beyond simply fraud and move closer to cost containment related initiatives, which focuses more prepay activity, even moving away from some of the legacy post-pay activities that have been successful in the past. So that evolution has really moved us all from historically large volumes of data looking post-pay to, and really focused on fraud, to focusing more on waste and abuse and simply errors in coding and billing. We all know that as the complexity of healthcare continues to grow, and typically that's a great thing with new advancements in services and procedures, things like genetic testing that has become really, the technology behind it has grown significantly over the past few years. The coding and billing for those services has also grown exponentially, as well as the complexity. So there's a lot of room, not just for fraud, waste, and abuse, but simply for errors in billing and coding. And so the market has really helped, push us into more of a prepay and even provider education space. What that has also done is really caused a greater need for transparency in what we do so that we can help demonstrate the value that fraud, waste, abuse, payment integrity programs bring to our customers in the market, whether that's self-funded groups, federal government, and federally funded programs like Medicare Advantage or FEP, Affordable Care Act, et cetera. But all of our customers want more transparency into what we do. How are we good stewards of their healthcare dollars? How are we helping to protect their customers and their members? On the sort of aligned with that is the compliance. So what we've also seen, again, I would say over the past 5 years, is much more rigor around the compliance mandates that we have, whether, again, that's from the federal side, state and local side with insurance departments, or even our group customers. There's more and more requirements being added to our self-funded group contracts for transparency and for good programs to help ensure that those healthcare dollars are really safeguarded and spent on the right procedures at the right time and at the right cost. So that's a little bit of the market demand and the stem of the evolution. So the challenges that we all face, and I don't think these are new to anyone listening in on the call, but if we go left to right, we think about the silos that exist, right? And we think about the large silos of data that we have. Those could be in a data warehouse, they could be in our adjudication systems. Sometimes it's a little bit of combination of both. It could be at our PBMs if one is used, but you have all of these large vacuums of data, and oftentimes they don't communicate with one another, or we as a plan don't always have the best access to that data. We also have different types of technology that could be used. One entity might use, say, SAS programs or SQL to extract data. Another could have a specific bolt-on tool to their database or their data warehouse. And depending on the department or the operation, some groups might be better at using those tools than other. If we move to the right, those type of challenges are then compounded by simply the volume of claims. At Highmark, we adjudicate, well over 100 million, close to 200 million claims annually, and that's just on the medical side. So significant volume of claims that we're all trying to get through and extract the right information from. Historically, we've all used rules-based analytics, sort of going back to that pattern detection that we've all used for many, many years, which tends to be resource intensive, right? As we have new issues that continue to come up really on a daily or weekly basis, things like COVID, right? When the pandemic hit, at Highmark, we stood up a COVID task force to start looking for anomalies and unusual patterns of activity. And that's resource intensive. Again, we have different types of tools to pull data. We have different types of skill sets in our people. And as these new issues continue to come up, it's really a drain on our resources internally. Again, underlying that, we have many more compliance mandates. We continue to be audited as an industry by a number of regulators, and that takes time and people to make sure we hit the right information and we can meet those mandates. So what does all this result in? Fragmented systems. We have reporting gaps, duplication of efforts, provider abrasion, and probably most importantly at the bottom is missed opportunities, right? When we're not fully aligned, when we don't have access to all of the data and we don't have a great mechanism for identifying issues as they come up, then there's going to be missed opportunities for cost containment and potentially mitigating fraud, waste, and abuse related issues. So evolving our methodology, what we've really focused on is a holistic and more unified approach. And again, identifying fraud is always going to be paramount. I think from an industry standpoint, we all see the cost and the issues that our customers face when there's fraud in the system. Rena mentioned previously about $68 billion in fraud annually per the National Healthcare Anti-Fraud Association. So the numbers are staggering and that continues to go up on an annual basis. Savings, right? We're all looking for how do we drive down medical cost savings? And that's not just as a plan, right? We all face that again from our customer base saying, how are you good stewards of our medical dollars? And how are you helping to drive down the cost of healthcare? Underlying all that, again, is the transparency. So how do we bring good information back to our customers, as well as the providers, that we're auditing or that we run claims analytics on? So we need to help our providers to understand where are the errors that we're seeing in their claims data, help them learn and educate. So some of those mistakes that I referred to earlier can be addressed as quickly as possible. And so that we can bring, again, that cost savings information back to our customers. That's no longer a differentiator for a health plan. It's really a business imperative for us to be able to do that and stay competitive in the market. And then, in order to do those first three things, we really have to be able to stay ahead of waste and abuse. I think we're no longer at a point where we can put everything on a post-pay basis and wait, 12 to 18 months after a claim has paid in order to find those patterns and trends. We need to be able to find these issues as close to or during the adjudication process as possible. And that's not just because it's the right thing to do or because it's a better ROI model. But if we even look at some of the drivers in the industry, certain states are continuing to push down their post-pay look-back periods from, historically maybe 24 months to 12 months. Some states are now putting in 6-month look-back periods for post-pay audits, which really makes it difficult to have a really stringent post-pay process in place. We need to move that closer, again, to or during the adjudication process. So with all that, we need better predictive analytics. We need to be able to flag the suspect claims and or providers or members as close to adjudication as process. We need to continue to listen to our provider community and understand what their needs are. Again, going back to education, one trend that I think I've seen in the industry over the past few years, which has really been helpful, is working with providers a little bit better and trying to give them insights into what we're seeing in our analytics. when we see those mistakes in billing, when we see the errors because maybe there's new codes that are being released, and the complexity continues to rise, really trying to give those insights back to our provider community. Of course, when it's a fraud or abuse issue, that could be slightly different. But for some of these truly mistakes, how do we help the providers to get past those? And then there's a demand to embrace technology. Again, I think there's really been a push over the past, I'd say, 3 years, especially with artificial intelligence and organizations like Cadoxo, really upping the game in fraud, waste, and abuse and payment integrity. With, again, not just looking at rules-based analytics, which are good and certainly have value, but again, how do we add AI to the equation to identify these issues as soon as possible, and even unique areas that maybe a rules-based system would not identify. So as we all know, there's a lot of situations where it's not just A plus B equals C. It's a lot of times A plus C equals E, and we've got to be able to account for those type of scenarios. So moving beyond fraud, ideating across fraud, waste, and abuse, prepay and postpay. So again, historically, I think we've all operated very heavy post-pay focus. And with payment integrity, we all hear the mantra of moving to the left. So moving closer to prepay and even moving beyond prepay to education of providers when we see issues that can be resolved. At Highmark, we began using artificial intelligence recently within our prepay efforts as well. And so we're always going to have some rules-based systems. We're always going to do certain post-pay activities because we need to do those things. Looking at claims history, for example, we need to be able to do that and incorporate that in our payment integrity stack. We do have approximately 30 initiatives in our pre and post-pay payment integrity activities, but the one that we've recently added for fraud, waste, and abuse is putting AI, putting Cadoxo into the adjudication process, upfront, as close to claim payment as we can. And essentially what we've started doing is, as a claim adjudicates and pays, we run the AI software against those claims and look for anomalies within an individual claim. So not necessarily waiting for a large volume of claims to pay and going back and looking for anomalies that way, but trying to really shift and look at a claim by claim, provider by provider basis to identify something that, what looks unusual about that claim compared to every other provider of that specialty, every other claim that paid for the same type of service. And AI has allowed us to identify some pretty unique issues that we've been able to stop and root out. And I'll get to a couple of those examples here in a minute. But that's where we've really integrated artificial intelligence into our payment integrity stack. From a reporting standpoint, so I mentioned previously that our customers, and I really define customers as, again, I mentioned federal entities, CMS, for example, the federal employee programs, as well as our self-funded group customers, our individual fully insured customers. But I also look at our customers as federal, state, and local law enforcement agencies because we work with them on a really significant basis and really on a daily basis. And one thing that we found is really important to them and helps them to understand, what are the issues that we're seeing and how can we help translate all of those facts and information as simplistically as possible, is by using certain graphs and information that can be really consolidated and aggregate that large volume of data into an easy to interpret and read piece of information. So we've really started to leverage a series of graphs and consolidated information, whether it's a pie chart, a bar graph, et cetera, a line graph. But we've really found this to be helpful in investigations. And it's really helped us to show law enforcement, here's what we're seeing on a provider versus their peers, the claims, again, versus all the other claims for those services. Here's what really stands out and why. And that really helps in those investigations to tell the story instead of having all of these, thousands of CPT codes and procedure codes and diagnosis codes and trying to interpret that, let the graphs speak for themselves. And we've had law enforcement come back and say, hey, the information that you provide, it's really like paint by numbers. It really helps us to understand what the issues are and really helps tell the story in a very simplistic manner. So we've really started using a number of these graphs that we found within our AI platform, Codoxo as well. Provider education and compliance. Again, I think we're all seeing a big push for better provider education. Again, I know on our side, we have about 40 compliance mandates that we have to meet each year as a fraud, waste, and abuse program. And, that's significant. That does take a lot of time. You really have to have all of our information, whether it's case information, claims information, buttoned up and really easy to report back to the regulators. What we're seeing is the trend is our regulators will go back, maybe 5 years, and they want to see every case we had, every claim that we audited, even down to every CPT code that we looked at. So you really have to have great reporting. You really have to have great transparency into that information and a really, really sound case management and tracking system to be able to find that information. And again, that's driven by regulators, but it's also our group customers. Again, as I mentioned, they really want to understand how are we good stewards of their healthcare dollars. And the best way for all of us to show our value proposition is by showing the savings that we drive, in the cases that we have and how we protect their members year over year across the spectrum. So I think that's significant too, and that's part of the evolution that we've all talked about.
Okay, so Kurt has mentioned a lot about AI, and you can see here the dictionary definition of AI. However, it's maybe a little bit simpler to think in terms of as a non-healthcare consumer, AI really is all around us. If you think about if you're a Facebook user or Netflix and you see recommendations pop up just based on movies that you watched, that is AI in action. But from a healthcare perspective, what the AI is doing is, if you think about it as a human intelligence being replicated in a computer. And once one computer is thinking like the human being, you quickly have hundreds of them doing the same, and the AI is able to derive data and insights and actionable information from that data where that would have normally required hundreds of people to do the same amount of work that the AI is doing. Kurt mentioned the drain on resources for all of the work that a health plan has to do, all of the different reporting requirements and regulatory requirements as well. So the AI really plays a big role in helping plans like Highmark to account for all of that drain on the resources. There are players in the clinical space in the AI area. However, from a healthcare perspective, there really hasn't been the use of AI in healthcare the way that it has been on the clinical side. And then here, just showing the benefit of AI across the claim spectrum. So the ability to look at large amounts of data. Kurt also mentioned all of the volume of data, the disparate data sets that are there. They're available. However, they're very difficult to derive insights from. So in the case of AI, big data actually presents a great opportunity, because the larger the volume of data, the better the AI is going to likely work. So having all of that data is a really good opportunity for the use of an AI type of application. And so the AI is identifying all of the claims data, analyzing it, identifying the patterns first and foremost of, okay, what do we see here that's anomalous? What is standing out? Then the thing about AI, especially coming from academia, is that the AI is completely agnostic to the data that it's looking at. And so that brings a very unique and different perspective that hasn't been in this industry before. And so it's able to quickly find anomalies, again, agnostically, just saying that this looks suspicious or this looks unusual as a pattern of behavior. And so that is the way that the AI is able to detect new fraud potential or new schemes to the user. It also, as Kurt was also describing, displays it in such a way that is easily explainable to maybe a non-healthcare user or an investigator or law enforcement, that's in a graph form that shows really good comparative analysis. And when it's doing this, it's identifying things that are being done either intentionally or unintentionally. And then that's where experts like the folks on Kurt's team take a look at that information and start to build those connections to understand what all of that data being displayed to them means and how meaningful is it and how actionable is it. And so being able to do that historically and from a traditional sense in the payment integrity and fraud space, we have all worked in siloed areas looking at different types of claims, or a team works on pharmacy claims, for example, or on dental claims. But in the AI's case, or being able to have reporting across all of those types of claims, it gives you a much better insight and much better perspective on what is happening at either a provider member level across all of those claim types in one platform and with tremendous efficiency. So there's great value there with using the AI for identifying all of these different types of patterns.
So I wanted to provide a couple examples of cases that AI has identified, which were fairly unique. The AI has identified a number of top providers with the highest risk scores. And so basically the way that we're using AI is, and I learned this, the more familiar I've gotten with artificial intelligence and how it works, is that the AI we use can take in, essentially in layman's terms, can learn from what it ingests. So it can learn from the claims that it looks at and understand, hey, this looks different. This looks unique from all the other claims that have similar codes or are being billed by similar specialties. This looks different and unusual. So it can learn from sort of itself, if you will. It can also learn from information that's fed to it. And so if you have certain schemes or certain areas that you want it to focus on, it can look at that and find the pattern detection within that claim set. And it can continue to kind of refine itself and get better and better. So not a true rules-based application, again, where A and B have to equal C, but it can look at those things that look unusual and point those out to you as potentially a suspect area. And so where that's helped us is we had a case where we had a contracting issue of a substance abuse rehabilitation clinic was billing us essentially incorrectly. Their contract allowed them to bill for certain services at certain rates, and they were billing us above those rates and basically outside of the contract. And the system simply didn't find it. It allowed the provider to continue to bill at a higher rate for things like intensive outpatient therapy or inpatient services that they weren't contracted to perform. And so what we were able to do with artificial intelligence is the system found that and said, hey, this is unusual. This provider is billing at rates that are significantly higher than other providers of the same specialty, and it just looks unusual. And so that's something that a rules-based application really wouldn't have found. And this came out as a pretty significant dollar case for us. And it was essentially, again, it was a contracting system issue. We had to go back and get that changed in the system, work with the provider to change and educate from a billing standpoint. So that was one example that was really unique, but it was really high dollar change for us. Another one was a provider that was billing for psychotherapy codes that were 60 minutes in duration when they actually were 50 minutes in duration. And they also were billing for individual therapy when it was actually group therapy that was being performed. And so the AI software was able to identify that again and said, hey, this looks just different from other claims that other providers of that specialty are billing. Not seeing a lot of 60-minute one-on-one sessions. It's typically more group therapy. And so that was another, pretty high dollar case that came out. And it was simply because it looked different. It looked unusual. And so it wasn't a rules-based issue, but it was just more of AI saying, hey, I've looked at all of these claims. Again, we pay, well over 100 million claims a year. This one particular set of claims looks different for this one provider, and allowed us to take a look at it and remedy that abusive situation. From an overall goal and results perspective, so we have a number of goals and objectives and metrics that we measure ourselves on every year, similar to other payers out there. A lot of consistent metrics that we use: return on investment, total dollars saved or pulled back, medical cost savings, et cetera. So this slide simply highlights some of the information that we had from 2020. Our team had $220 million in savings related to fraud, waste, and abuse. Since 2015, we've had about 1.1 billion in cumulative financial impact. And that's really on our post-pay payment integrity side of the house, including fraud, waste, and abuse. So our payment integrity program, we have a group that focuses on prepay activities. My team focuses on everything post-pay, including fraud, waste, and abuse, the traditional special investigations unit, and we work together. Very good partnerships between our pre and post-pay teams. But this highlights again, and then some of the dollars by product line too are highlighted there.
Thank you very much, Kurt and Rena, and thank you all for attending. I hope you have learned and enjoyed the session. If you have any further questions or would like to connect with Rena, Kurt, or anyone from the Codaxo team, please feel free to join us in the AHIP booth, in the Codaxo booth at the AHIP conference, or visit our website at codaxo.com. This concludes our session. Thank you so much for attending.